Hi, I'm Sue O'Dell, Madison's mom.
And I'm Maddie.
From a parent perspective on what to expect when having your child come to Children's in the eating disorder, basically how it works is we came in and had her evaluated. They determine that day whether or not they will admit them. Maddie was sick enough that they did admit her that afternoon, and we had to go home. We didn't bring anything with us for her stay here. We didn't know how long she would be staying. So we had to go home and gather all her belongings, and I remember bringing them back that night. And so Maddie had her own room, and that was kind of the end of our first evening here at Children's. And so what we learned as we went along is that the family is so important in the child's recovery, and so you're involved in every aspect of their treatment. And so we were taught how to come up with meal plans for Maddie and caloric values and why they have them eat things this time of day, and why they're so strict on where they eat and when they eat and the amounts that they eat. We just had no idea of all that was involved with that. And then there's the counseling component, and where families are involved in family therapy, and then individual therapies with your child, and therapies if you have other children, they're involved in those. But the thing that is most impressive about Children's that we didn't know is the team approach. So there's so many people involved in the recovery. So there's nutritionalists, and there's counselors, and there's a MD. Maddie had Dr. Kaplan, and there's a psychiatrist. We were lucky enough to have Dr. Hagman. So there's just a whole team of people that are looking out for your child's well-being and helping them on the road to recovery. So I think that you just have no idea just the depth of and wealth of people that are here to help your children.
I think from the patient standpoint, you have to be prepared, to get everything taken away from you. They strip you of pretty much all of your rights, which isn't fun at the time, but as I look back on it, it really is important to recovery. Your parents don't get to stay with you like in the regular hospital, which is kind of different, but you can see the pros and cons of that. You kind of learn to live on your own, and you don't have the stress of the family around all the time. And I think that was really helpful to me, at least for the first week, because you eliminate everybody else's opinions pretty much. I had to take time for myself and kind of figure out what I needed to do in order to get better. But I think for parents, I think you have to learn to be patient, because there really is no treatment time period. Each kid is different, and each treatment of an individual is different. So some kids are there for a week, some kids are there for months. It really just depends on how sick you are and how driven the patient is to getting better. The unit is gorgeous. Definitely not what I expected. I expected the white walls, general hospital kind of setting, with machines and just like a bed with a curtain, and it's definitely not that. The walls are lime green and bright blue and purple and pink, and it's actually really beautiful. They do have one room which is a split, like a shared room, but the rest of the patient rooms are single rooms. So you get your own room, and it has two giant wardrobes on the left, and your own patient desk with a really cute green chair. And you get a whiteboard and your own phone and a little coffee table, and it's really nice. It really, all the patient rooms have windows, and you let all that light in. It's gorgeous, and it's not what I expected. Across from the patient rooms, there's a little nurse's station, and so they're always just right across the hall. You don't have to travel far if you ever need any help for anything. And I don't know, it's a great place to be when you're sick,